President of Ghana, His Excellency John Dramani Mahama, na kache na eho na sabre de beka ne se conference bi akoso ewo Ghana hanum say the Accra Reset Geneva meeting na ye mampani His Excellency John Dramani Mahama edisha nhyiemudie ehye so na mpanimfo akukudam na ebepie mu ewo sa nhyiemudie we ase na de pie mu say World Health bo ye mampani John Dramani Mahama abaso pa isan say ye hwemu a vaccine sika bia ya ye tuatua no mampani atimi abone homodene etua $22 million the ama sa initiative na wo mobo mampani abaso for working tirelessly to make sure say eniema ebekoye. Now a lot of people were asking says I'm meeting we no dear na adenti any ade but uhwemu ejumekuwa kese a wo mo ebepie mu wase no World Health Organization, World Trade Organization, the Global Fund, and African CDC. No munyina representatives ewo sa jumedie we ase and is looking at kwaya ebibi mine ebetimi ahwe niema fire pomudin wonsem yempuntuo sikasem investment wise strategies ebetimi ede ahye mu eni ade na aboa ama niema etimi akoso yie ede ama the African continent as a whole. Na abasobodi omodebo President John Dramani Mahama no yebekwa kotie mu ensem why they are praising Yemampanino for such mechanism an initiative and ne modern bo awobo as a president of Ghana. Enti ebusenko na yenkotie ensem nimu emraye ba yatoa enkomotwetwe ne so ede amamu.
Appeared with a long retinue of people, McDibble and all of them. It's about 7 of them. And said, Mr. President, there's something happening. You know, humanitarian assistance is dwindling. ODA is falling. It is time for Africa to take its destiny into its own hands. And I said, oh, President Obasanjo, I have too much on my plate. I just took over as president. Our economy is in a shambles. I have so much work to do. I don't have time for another of your many courses. But President Obasanjo is not somebody you can say no to. He cajoled me. He commanded me, did everything in the book. And here I am, champion of Accra Reset. By the side, we have a lot of work to do. Even though we've increased investment, we uncapped the national health insurance, and we freed up $300 million of extra funding for our health system. And that is what has helped us to do a lot of the things we're doing. There's an explosion of non-communicable diseases, mostly caused by lifestyle, changing lifestyles. Our societies are modernizing. People don't engage in too much physical activity anymore. And yet some of our foods were invented by our ancestors to provide us with energy for physical activity. Africans were very physical. Today we're no more physical. We wake up in the morning, drive to work, sit in an air-conditioned office the whole day, close in the evening, drive to the nearby pub, sit with your friends, have a drink. Then you drive home, and you get home late, and you're hungry, and you ask for food. And I use the example of banku. It's a doughy kind of food made from maize, high in carbohydrates, and it can be heavy in the stomach. And then you eat that and go straight to bed. And so we have cardio incidents, we have explosion of diabetes, we have kidney ailments. We have cancers, different kinds of cancers. And the treatment has been very expensive, and so we decided to introduce what he said, the Ghana Medical Trust Fund. In many households, if one of the members is afflicted by any of these diseases,
because we fundamentally believe that the definition of sovereignty is to be able to mobilize indigenous revenue and to be able to deliver services to their populations. Now, in terms of your question, how is our model changing? We are basically aligning with the sovereignty movement. This is what the Gavi Leap is about. This is how we've pivoted. Because we made a decision 2 years ago, as we read the tea leaves, as we saw the cards playing out, that we're not going to wait for the World Health Assembly to give us normative guidance on how to restructure, that we have to reform ourselves today. And we're quite further along in that journey in transforming ourselves. We are basically, the Gavi leap is basically Accra reset in implementation. The Gavi leap is the Lusaka agenda in implementation. And we've actually taken tangible steps to recast our model. I'll give you some examples of that. For instance, we are ceding decision-making to countries. They are now taking decisions on how to allocate prioritize their vaccines and vaccine budgets. They're deciding who to choose as technical partners. We've radically simplified our model after 2 years of hard work, because this is what we heard from countries. They said, we greatly value Gavi, but your processes are very onerous. We've worked incredibly hard to radically simplify and to end-to-end digitize our processes and to give real-time visibility to countries. We are also investing over $100 million in strengthening fiduciary systems and of taking solutions to the system solutions to scale. Today, every health minister is grappling with some of the constraints that are endemic to public primary healthcare systems. You know, hemorrhaging supply chains, rent-seeking in procurements, pervasive absenteeism, and many health ministers are deploying some very radical solutions to overcome those constraints. We just heard from the Honorable Minister of Health of Kenya about the distribution chain security solution that he's deploying. At Gavi, for instance, one of the things we've decided is we're not going to pay per diems on the ground, exceptions notwithstanding, unless payments are made through cell phone payments. Simple solution, but needs to be deployed at scale. And then, of course, we are, and I say this with a lot of humility, we are investing in Africa's future with respect to vaccine manufacturing and the dream of vaccine sovereignty, and they have every right to have that dream, and it is our responsibility to support them. You know, the African Vaccine Manufacturing Accelerator is an example of that. We deployed that solution as a subsidy instrument. We kept our ear to the ground, and we heard that Africa wanted modifications. So this July, I'm taking a package of interventions to modify that subsidy instrument to be able to invest in the pre-financing.
Hosted by the president himself, John Dramani Mahama, no, and I could see and some way Mufi by and I say, yeah, Bomampenia Baso, when it comes to the payment of vaccines, is an initiative that has been in existence for a very long time. Now, Mampeni, dear, were to me, I respect who come Ghana, what tea and him, Amaya making a payment that now Jumedi no ena mampeni esan etu nenumutu ekasaye edefa eniema ohunu se we can do as a country and as Africa ebeboa yen na ama yapomudi hu nsem no etimi egina ye egina brande ewo man Ghana any African continent ni emu yebetie say there is Excellency John Dramani Mahama edinsem we etu montin so.
They need to be able to invest in the ecosystem support that they demand, to be able to bring to the table demand guarantees, which are which are going to be a very important component of Africa.
Go on their own, but what they forget is that we're passengers in the same bus, and that bus is this globe. No country can live in isolation. There are some things we cannot deal with alone. We need to come together as a world to do that. And the only way we can do it is through the multilateral institutions that we have. And so if you say you don't want to have anything to do with World Health Organization, we're withdrawing funding and all that, they say it's not a matter of if, it's a matter of when the next pandemic would hit. And pandemics know no citizens. They don't know Ghanaians, they don't know Britons, they don't know Swiss, they don't know Americans, they don't know Africans, they don't know Asians, they don't know Caucasians. If pandemics hit, they are indiscriminate. Today, he is having to run back to Congo because of the outbreak of Ebola. And it's ironic, some of those organizations that people are withdrawing from and gutting have helped to evacuate some of their citizens from the epicenter of the Ebola outbreak. And so the multilateral institution you thought was not fit for purpose, today you are relying on to safely evacuate your citizens from the hantavirus ship, from Ituri, where some of them are working as medical officers. And so we should have a rethink. We should act locally, but think globally. And so we do all in our power, in our own countries, to try and take our destinies into our own hands. And in Ghana, we are walking the talk, like the minister was saying. Since last year, we've increased coverage to 66% of the National Health Insurance Scheme. But what of the other 34% without coverage? And financing at the point of care is the most critical. And so, like he said, we introduced the free primary health care this year successfully using our own funding. And it was a joy to see the healthcare workers who work especially in the rural areas, from the CHIPS compounds to the health centers to the polyclinics. It is free of charge for every Ghanaian who shows an identity card and goes for treatment. And so that day we handed over equipment to them. They got scan machines, they got tricycles, and indeed there was some uproar about the tricycles. Some people misidentified them as ambulances and said, look at the ambulances Mahama is bringing. I mean, what kind of ambulance is this? You know, the tricycles were actually meant for health screening, so that for those who don't know how to ride a motorcycle, they could use the tricycle to go to the communities to do health screening. But then the point I thought was, yeah, so if your wife were bleeding and was due for childbirth, and there was only that tricycle in the village, will it be...
Abusia, that is the President, John Dramani Mahama, and our Kasa about the strategies at Ghana Hanum de Yetimia Fa, the primary health care near the idea Wetimia said the Beya, Apomudin Sem, Ebekosuyi, intine with the other African continents, and so on. There should be strategies at Ebeboa, na Yatimia boy and Hoban, if we are rear, any idea at home. Now, Yenfree President John Dramani Mahama, and Semiso, na Yenko Piemu, Ewon Sem for so, but still in the NDC.